Associate Professor Ahmad Alrubaie is a gastroenterologist at the Bankstown Lidcombe Hospital. Salam alaikum, Professor. Good evening.
Salam alaikum, Eileen.
That's about as far as my Arabic got when I lived in Lebanon, unfortunately. I have to ask you, though, you're so ingrained in the Arabic-speaking community in Western Sydney. Do you think that there's what we're calling vaccine hesitancy in your part of Sydney, or is there confusion and fear?
I think it's both, but it's more hesitancy. And I think there are a few factors which impacted on the community decision regarding vaccination. The most important one is the negative impact of the anti-vaccination propaganda, particularly through the social media related to the community. Also, the negative impact of the media focusing on the side effects of vaccination, particularly the AstraZeneca. In addition to the good outcome, we have the control of the first and second wave, which make people more relaxed and actually less motivated to have the vaccine. So we can say that this is a major task for us as a health professional and as a community leaders to calm down the anxiety of the community toward the side effect of vaccination, particularly I'm talking about the AstraZeneca, and also promote the importance and the critical role of vaccination in controlling the pandemic and putting an end to all the suffering coming by the recurrent close downs, etc.
Not that we want to go through what is actually being spread in the social media, but I know that you're actually holding webinars to try to counter it. How are you speaking to the specific fears that people are bringing to you, or are you doing more of an education campaign about why it's important to take a vaccine like AstraZeneca?
No, we know in details the precise concern of the community regarding the vaccination in general, their importance, their role, and also their impact, short and long term. And we have this corona vaccination campaign, which we tried to start 3 months ago, actually, starting by reaching the religious, social, and academic leaders of the community. And then we moved to the NGOs, the organization in the Arabic and Middle Eastern community. And then we start to have the first session of face-to-face education and calming down the anxiety. And over the last 2 weeks, we have 2 webinars directed to different areas of Sydney where there's a bulk of Arabic and Middle Eastern community. And we managed from the feedback to relieve a lot of concerns and correcting all the misinformation people had through this one. And we have actually now better motivation among the community toward vaccination.
Do you lay blame at the feet of any one specific group, you know, the New South Wales Health perhaps, or the federal government? Or is it just that the speed at which this particular Delta variant has taken hold of southwestern Sydney that we've been just unable to keep up with the spread, and thus people are kind of still wondering, what to do in terms of getting a vaccine?
Actually, generally speaking, Australia did well in the first and second wave. And if we look at the mortality rate, it is very low, the number of cases. But we're dealing now with those mutated viruses, which make the pandemic even worse and the spread even wider, and the risk of difficult cases is even harder. So I think this is a major factor in the current situation, the high transmissibility of Delta virus, which is the dominant copy or strain of the virus right now, add a lot to the wide effect of the virus. It's hard to blame anyone right now, but we have a situation where we need to do more at all levels, the government levels, the organization, the NGOs, communities, leaders, and individuals to help in controlling this problem.
Do we need to be a little bit more inventive, perhaps, with the way in which we're going about this communications campaign about why to take the vaccine? Perhaps going to mosques, going to churches, going to community leaders. Is that already underway, or should we be doing more?
In fact, for us, for our campaign, which is, by the way, arranged by the Iraq Restoration Medical Association in cooperation with the Arab Council of Australia, and we reach a wide majority of the community. We started with the religious leaders, and then we moved to the media, to the local media, and the organization, the NGO organization. And I think more of this work is required right now. And in fact, we are arranging another webinar targeting youth, targeting young people, where we have a lot of hesitancy or underestimation of the impact of the pandemic on one side and the role of the vaccination. So I think we are working on this line. Recently, you heard that the representative from various sects of the religions in the community have a call toward the Arabic and Muslim community in regard to Al-Adha Eid there. And I think there is a good response in this regard.
Just finally, Professor, have you seen a change in sentiment from, say, a month ago, from when we didn't have any, COVID-19 that we knew of in the community until now we've got so much? Are you actually seeing this outbreak in part shifting people's choices?
I think so. I think the pressure of the problem is a major factor in changing the decision. And that's what happened actually in UK. In UK, no one was asked about the type of vaccination when the number of cases were in tens of thousands. All of them, they went whatever available as vaccines there. And in fact, 20 million of the UK people have the AstraZeneca in spite of knowing the side effects. So I think the pressure helped changing the decision of a wide spectrum of people.
All right, Professor Alrubaie in southwestern Sydney, thank you very much for your time tonight.
Thanks a lot.